I'm going to do Dr. Strutt's protocol for the lower extremity. So first I'm going to do the glute medius muscle test. So resist. And resist. That indicates that I need to adjust because it's weak, but I can also use the indicators. And for pronation protocol, it's a positive navicular drop test, posterior lateral heel wear, or the patellar approximation. So now to adjust, I'm going to start with navicular, cuboid, cuneiforms, and we're going to do the met heads, and then talus, right now, yeah, talus, calcaneal, phalanges, and fib head. Making sure my knuckles are not visible. Then I'm going to retest. And it's strong. Okay, I'm going to do the iliopsoas test. I'm going to bring her leg up 45 degrees, out 45 degrees, and externally rotate. I'm going to have her resist. It is weak, indicating I need to adjust. This time I'm going to do the supinator protocol. And the indicators for that are a negative navicular drop test, excessively high arches, a combination of inversion, adduction, and plantar flexion. So first I'm going to do the navicular and cuneiforms, which you do together. So come, this cuneiform, okay, I'll do this one. Cuneiform. And cuboid, you do the same as the pronation protocol. And now I'm going to do the met heads, but leave her foot on the table. Next is the talus. You go with the outside hand first. And then calcaneus. Phalanges, and the fib head, which is also the same. And then I'm going to retest to make sure we correct the problem. So up 45, out 45, externally rotate, and have her resist, and it's strong. Right, now I'm going to assess the knee. There's 3 different findings you can have. It can either be a medial condyle, posterior tibia, or a lateral condyle. So I'm going to be assessing for movement because there shouldn't be any. I'm going to put the knee in full extension. And she has movement going lateral to medial, indicating a medial condyle. So if I have you flip over for me. I'm going to take my tissue slack from lateral to medial. Adjust. And then if I can have you flip back over, I'm going to reassess and check for movement. Again, locking out the knee. And there's no movement. So now I'm going to do the anterior femur. And I'm going to muscle test for that, so if you could resist. And it's weak, indicating I need to adjust, so I'm going to flex her knee and then feel for the most resistance, and adjust through. And then I will retest. And it's strong. So now I'm going to do an alternative talus, so I can have you flip over onto your stomach. And come off the table a little bit. There you go. And then usually it subluxates mostly lateral and slightly anterior. So I can have you scoot down just a tiny bit more. There you go. Going to have her foot off the table and pulsate straight down, or just straight down. And then if I can have you flip back over. Now we're going to do the big toe. Your outside thumb comes in first, and then your inside thumb, and you adjust. And the next would be if she had bunions, and it's just a slip adjustment. Okay, I'm going to assess the patella. I'm going to feel for springiness in all directions. And she has restricted movement going inferior, so I will adjust in that direction. And then I will reassess to make sure there's movement in all directions. And there is. So now I'm going to test the internal and external rotation of the femur. First I'm going to do the TFL muscle test, so I'll bring it up and out 45 degrees and internally rotate and ask her to resist. And it goes weak, indicating I need to adjust. So first I'll test the internal rotation. It's springy, so I'll test for external rotation. And it's restricted, so I'll adjust P to A. And then I'll retest the TFL. Resist. And it's strong. Okay, so I'm going to show how I'll do my wrist extension technique. This is going to be my pressure hand, and it'll go like this. Pressure is going to be spread evenly all the way throughout, and this will be my speed hand, and I'll make a V like so. And then I'll put my leg up here, and then that's how it goes. And then right now I'll have my patient lay on the table, and I'm going to assess her knee. I'm going to put it in full extension. There's movement from lateral to medial, indicating she has a medial condyle out. So I'm going to have her flip over. My pressure hand will be exerting about 50 to 70 pounds of pressure, and my speed hand will be exerting about 10 pounds of pressure. So locate her medial condyle. And I will adjust. And then I'll have her flip back over. So I can retest. And there's no movement. Now I'm going to test for the anterior femur, so I'm going to have her lift her leg up and resist. It goes weak, indicating that her femur needs to be adjusted. So can I have you scoot a little bit that way? I'm going to find her greater trochanter. My non-dominant pressure hand will come up and approximately right here. I'll be placing about 10 to 15 pounds of pressure on my non-dominant pressure hand and about 10 pounds of pressure on my speed hand. And then I will retest, resist, and it's strong. Now I'm going to test the for an anterior humerus. So over, lift our arm up and resist. It goes weak, indicating that I need to adjust. My pressure hand will be placing about 15 pounds of pressure, and my sweep hand will place about 10 pounds of pressure. I'm going to find the deltopectoral groove right here. If I can have you look that way. I do that every time. And then I'll retest. Resist. And it's strong.